This is Dr. Magaranna from Magrasamy. Welcome to my YouTube channel. And today's our topic is trials in homeopathic system of medicines. These trials are extremely important. These trials are extremely important from the exam point of view. That is in first year BHMS exam, second year BHMS exam, third year BHMS exam, and fourth year BHMS exam. And I will also tell about how to write these trials in exam and how to use these trials in first year exam, second year BHMS exam, third year and fourth year. So let's get started. First trials is trials of ABC nursery. It is given by Dr. J.H. Clark. This trial is given by Dr. J.H. Clark. This trial is also called as trials of turmoil. And in that we have three remedies, that is aconite, belladonna, chamomilla. That's why it is called as ABC nursery. It is also called as trials of turmoil because aconite has turmoil in circulation. Aconite has turmoil in circulation. Belladonna has turmoil in brain, and chamomilla has turmoil in temperament. And how to write these trials in exam? That is, you have to write, first of all, you have to draw the diagram, and in that diagram, figure trials of ABC nurseries. This diagram you get half mark or 1 mark. Half mark or 1 mark. This is first diagram. And second sentence you have to write. If aconite comes in your exam, that is aconite mind or aconite fever, then you have to write that is aconite is one of the trials of ABC nurseries. And other two remedies, second sentence, that is other two remedies are belladonna and chamomilla. And you can also write this also. Aconite has turmoil in circulation, belladonna has turmoil in brain, and chamomilla has turmoil in temperament. That is nature of the persons. Mental calmness is completely contraindicated in chamomilla. That is mental he never calm. Belladonna, turmoil in brain. That is violent type of mania. That is madness. Belladonna has madness or beautiful lady. Circulations, that is cardiovascular systems. Second trial is trials of pain remedy. In that we have again three remedies, that is aconite, chamomilla and coffee acruda. These two remedies are also in the ABC nurseries, aconite, belladonna and chamomilla. These are the three remedies of ABC nurseries. And aconite, chamomilla, here also comes the pain remedy. And in every situation, that is appendicitis, headache, in all conditions, when there is a pain, we can give this pain remedy to relieve the pain, or it acts as painkiller in homeopathic system of medicine. How to write in this exam? How to write in your exam, university exam? That is, first of all, you have to draw the diagram, and in the figure, name of the figure, that is trials of pain remedy, and sentence, that is, this is first and this is second sentence, that is, if chamomilla comes in your exam or aconite comes in your exam, that is, you have to write chamomilla is one of the remedy of trials of pain, and if another two remedies are aconite and coffee acruda, you have to write this. If coffee acruda comes in your exam, then you have to write coffee acruda is one of the remedy of trials of pain, or other remedies are aconite and chamomilla. Somewhat like this, you can write three sentences from one trial, or you covered three remedies. If you remember the one trial, you can cover three remedies. And in HMM, that is homeopathic materia medica, remembering the things is very difficult task. That's why I come with this trial to remember the things. If you remember this 50, 60 or 70 trials, then you can remember the 180 remedies. If you remember 60 trials, then you have remembered the 180 remedies. Third trial is restlessness. Trials of restlessness. In that again we have three remedies: arsenic album, aconite and rustock. Aconite has mental restlessness. Rustock had physical restlessness, and arsenic album had both mental as well as physical restlessness. You have to draw the diagram in your exam and write this remedy. If Rustock comes in your exam, you have to write Rustock is one of the remedy of trials of restlessness, and other two remedies are Rustock arsenic albums and aconite. These two sentences and one diagram. You will get 1 mark in your exam. And this fourth trial is trials of burning pain. In that again we have 3 remedies: arsenic album, sulfur and phosphorus. And how to remember this? The trick ASSP. A stands for arsenic album, S stands for sulfur, and P stands for phosphorus. How to write in your exams? That is, first of all you have to draw the diagram. The name of the diagram is trials of burning pain. That is burning pain. This is first number. For example, sulfur comes. Then you have to write sulfur is one of the remedy of trials of burning pain. And other two remedies are, third sentence, other two remedies are arsenic album and phosphorus. Arsenic album and phosphorus. If sulfur comes in your exam, if phosphorus comes in your exam, then you have to write phosphorus is one of the remedy of trials of burning pain. And other two remedies are sulfur and arsenic album, except phosphorus. And you can also write fourth point, as these trials are extremely important for the homeopathic clinical practice as well. Album has acute burning, acute type of burning. Arsenic album has acute type of burning. Sulfur has chronic type of burning. And phosphorus has spotting type of burning. That is, spots are covered. You can write this much only because of only one trial. If you remember the one trial, you can cover 3 remedies. Fifth trial is trials of delirium. It is also called as trials of mania or madness. How to remember this? That is, bhms is the trick itself. That is, B stands for belladonna, H stands for hyoscyamus niger, and S stands for stramonium. And in between M stands for mania, that is madness. It is one of the trials of delirium or madness or mania. How to write in your exam? First of all, you have to draw the diagram. The name of the diagram is trials of delirium or trials of mania. First sentence completed. Second sentence, that is, if hyoscyamus comes in your exam, then you have to write hyoscyamus is one of the remedy of trials of delirium. And other two remedies are belladonna and stramonium. Fourth sentence, these trials are extremely important for homeopathic clinical practice. If you add some points, then there is other some points. That is, belladonna has violent type of mania. Violent type of mania. And hyoscyamus has lascivious type of mania. Lascivious type of mania. Lascivious type of mania. That is, lascivious is nothing but the exposes the private part. Hyoscyamus patient exposes the private parts out of fear. Because of fear that doctor will prescribe a wrong remedy. So he exposes the private part. That is hyoscyamus patient. And stramonium has a religious type of mania. That is religion. Religious type of mania. Patient thinks of God only. Sixth trial, that is trials of flatulence of abdomen. In that we have 3 remedies: lycopodium, carbovate and China. China is also called as historical remedy or cinchona officinalis. It is called as historical remedy because it is the only remedy which has made the history in homeopathic system of practice. That's why it is also called as historical remedy. China, that is cinchona officinalis. Other name of China is cinchona officinalis. And how to remember this trial? That is trials of flatulence of abdomen. For that we have trick, that is LCC. You have to remember the sequence. If you alter the sequence, then you will get confused. So you have to remember the sequence. That is lycopodium, carbovate and China. This is the sequence. LCC, lycopodium, carbovate, China. Flatulence of abdomen. It is nothing but the gastric symptoms. Flatulence means GIT symptoms, GIT complaints. That is hyperacidity, bloating, constipation, hemorrhoids, These are the flatulence of abdomen or conditions of GIT, gastrointestinal symptoms, GIT disorders. How to write in your exam? If first of all you have to draw the diagram. Name of the diagram: trials of flatulence of abdomen. This is first sentence. Second sentence: if lycopodium comes in your exam, you have to write lycopodium is one of the remedy of trials of flatulence of abdomen. This is the third. Other two remedies are remaining: carboveg and China. And you can add fourth point: these trials are extremely important for homeopathic clinical practice as well. I already said that you have to remember the sequence: LCC, lycopodium, carboveg, China. For that, because lycopodium has flatulence of lower abdomen, flatulence of lower abdomen, that is complaints of lower abdomen, lycopodium. Carboveg has flatulence of upper abdomen, and China, that is Synchonothicinans, has flatulence of whole abdomen or total abdomen. For this condition, you have to remember the sequence, that is lycopodium, carboveg, China. First of all, lower abdomen, then upper abdomen, then whole abdomen. This is how you can remember the trials of flatulence of abdomen. If you cover these trials, then you can cover 3 remedies at a time. And in homeopathic materia medica, remembering the things is very difficult task. So I come with this strategy to remember the things, and it is also helpful for clinical practice as well. In first year HMM, you can write these trials in HMM, homeopathic materia medica, or also write in the organon as well. In second year HMM and organon, second year subjects, that is HMM and organon. In third year BHMS, you can write third year BHMS. These trials are extremely important because third year BHMS have surgery subject. In that we have homeopathic therapeutic surgery. In surgery we have to write these trials in homeopathic therapeutics. Surgery paper 1, surgery paper 2. In third year BHMS, these trials are extremely important. Not only in surgery has 2 papers: surgery paper 1, surgery paper 2. In third year, these trials are also important for gynecology subject, gynae and obstetrics, in third year as well. In that again, homeopathic therapeutics, we can write these trials in homeopathic therapeutics as well, in gynecology and obstetrics subject in third year. And final year, it is extremely important in all the subjects of final year except community medicine. Thank you.